to find out of what was happening across Oxfordshire with PPGs. We spoke to community champions, practices that organise community events, how PPGs have worked quite closely with practice managers to ensure that the patient voice is at the forefront of every practice.
So our champions themselves are from a diverse community who comes together and talk to their own communities to understand what the barriers are in accessing health and well-being services. So we gather these insights and then look at solutions. So working with, for example, the Bob ICB or GP surgeries to actually address those issues. The migrant communities were saying they don't know that they can ask for an interpreter when they go for their appointments. So we have created a video to raise awareness about translation services that is available in GP surgeries. We have worked with the Luther Street Medical Practice to help them to engage with the homeless community. So the champions have created a postcard of the timetables of all the services within Luther Street Medical Practice and then shared it with the homeless community. I think one of the main outcomes is the empowerment side of things. They feel that they're part of the community and their voices are also heard.
I knew I needed something to fill my time, and it's a lovely way to give back to the community. We get involved as much as we can in helping out the practice. So we're all practice champions and we have various groups that are set up. The first one was the digital cafe, and then we've got a walking group, we've got a men's group, there's a menopause group, and I think what is really brilliant about the practice is that they're open to any groups being set up. If there's a need for it, a group will be set up for it.
So we hold digital cafes, which really is like a cafe, so it includes coffee and cake. Anyone can come along who has any digital challenge. We get lots of people obviously who want to get onto the NHS app, but it could be anything, even how to get onto WhatsApp, for example.
It's been very fulfilling, especially to see people who have come in really irked, going out with a sense of relief that they've actually can understand their app.
I'm not that technically able, so I was a bit unsure and needed a bit of support. For an appointment, you don't have to phone at a certain time. You can use it at any point when you've got a moment, so it does make your life a lot easier.
I would encourage all general practices to get involved in running a pilot like this. It helps them with engagement from patients, but it also helps them in being able to manage that front door. Now they have a proper triage system set up. They receive the messages via Engage Consult and the NHS app, and they are able to then allocate appointments that they have a better view as to what they really need. We have lots of positive feedback from the patients, and for us, it makes us feel good too.
Coffee, books and conversation. So this is a reading group, and we welcome anyone who loves to read. They might have some health problems that they'd like to talk about. I find it very rewarding to help others at the White Horse Medical Practice because they were so wonderful when they cared for my late husband. For me personally, it's a way of saying thank you.
There's an underlying reluctance for men to come forward and seek help. So it's another way of finding persistence, assurance outside of the surgery. People are not judged, questioned. They just turn up and chat, and we talk about almost everything. The initial idea of having champions was to take pressure off the GP surgeries by forming groups where people can self-support. Yeah, I think that any other patient group and GP practice should set something like this up. I just love helping people, and it's just great to put something back into the community.
It's really important to hear from the patient's side of their care and not just what we think that we should be providing. We worked quite closely together to make improvements, so we've recently worked with them to create our new website and also improve some of the ways that we work with inside the practice.
So the outcomes of the patient group are we devise a you said, we did, so that is evidence to our patient group of the actions of the feedback we've received as a practice and what we've come up with to try and improve our services for our patients.
So over the last few years we've looked at lots of different ways of increasing the patient group. We have a Facebook group for the patient group. We also have a Facebook group for the practice. We've found that we wanted to go to people rather than to come to us. So we're doing an event at the library for families, but also to promote the patient group there as well. Recently joined the Health Walk to see if I can get some input from that direction as well. Because ultimately what we want to do is improve the services with the practice and in collaboration.
There are 2 GP practices in this building. One is Church Street, which I belong to. The other one is Newbury Street. We try to run things as close as possible with the 2 practices because that way we're all singing from the same hymn sheet. We have a regular newsletter that comes out every quarter. People can download the newsletter using the QR code. We run a Health and Wellbeing Day every 2 years. We invite over 100 organisations. They let people know what's available that will help their mental and physical well-being. But we do try to make sure that everybody is covered and everybody knows where to get help when they need it.
Healthwatch Oxfordshire ensure that they are supporting patient participation groups. This is done via our website and also our news briefing. We offer the opportunity for PPGs to attend webinars. Last year we did a survey on the challenges that PPGs were facing. We're always here to listen to the patients and see how improvements can be made.